Our next speaker this morning is really going to be addressing an area that's been front and center for the whole year and became particularly interesting this week with the election down in Massachusetts. So here to talk about the healthcare industry, what she sees in terms of trends going forward, wellness programs, the environment, the regulatory environment. She could probably go on for a few hours, but she only has a few minutes, is Beth Roberts, who is the Vice President of Northern New England from Harvard Pilgrim Healthcare.
We're timed, so I have to start my timer because I think Sean is absolutely right. I could go on for hours. So I'm going to start that first. Well, good morning, everybody, and it's my pleasure to be here today. I do know that most of you would like to talk about federal health care reform, and I will embed that within my discussion today, but really I wanted to start by talking about the great state of New Hampshire. So what can you all expect as employers in 2010? Well, I think if you were watching what was going on at the state level, you know about a program called New Hampshire Health First that came to be in October of 2009. And that's a program really for small groups that the Governor Lynch, had decided that he wanted to promote wellness and really work with folks to have healthy lifestyles. And that's really what the state is looking at as we project forward and look into 2010. Harvard Pilgrim is beginning to see many, many employers trying to embrace wellness, healthy lifestyles, and really create that as the foundation for lowering healthcare costs over time. So the idea is if we all stay healthy and we all do the very best we can with our lifestyle choices and our choices about how we access care, then it will lower cost over time. So that will continue to be a trend for 2010 and beyond. Chronic disease. So a lot of people say the key driver for healthcare costs nationwide, not just here in New Hampshire, are chronic diseases such as diabetes, congestive heart failure. We all, as health plans, a lot of employers, a lot of hospitals have programs that embrace those disease states and really try to help people be as healthy as they can. It's really come with the recognition as being well. Not everybody is healthy. Some folks have chronic diseases that they didn't cause. It's something that they unfortunately have. It's a new idea that being well can mean you're sick, but you're being the best and in the best health or wellness that you can be. And that's really a new way of thinking for insurance companies, and I think employers should embrace that as well. Really, our goal collectively is to try to keep people as healthy as they can be, regardless of where they stand in that cycle. So what do we see will happen with plan designs as employers choose to embrace this new world of wellness and chronic disease management? We really see that folks are going to be asking for comprehensive coverage on preventive health care. So what do I mean by that? I mean, we see that we're in a world of high deductibles, co-insurance, higher co-pays, because that's what folks have needed to do to lower premium. So what you can do to counteract that is embrace this wellness and chronic disease, but you can also say, you know what, we want people to access the health care to keep themselves well. And the way you do that is making sure that for those wellness visits, you keep co-pays nominal. So $5 copays, $10. We're really in the neighborhood of $25 and $50 copays at this point, but making certain that you don't put those preventive care services within your deductible or co-insurance. Site of service, that's something that is terminology within the industry, but what that means is there's truly a cost divide between going to a freestanding, let's say, radiology center or a freestanding lab or a freestanding ambulatory surgery center. The cost for that is much cheaper than going to a hospital-based surgery center, a hospital-based MRI, or a hospital-based lab. We see some health plans who are introducing products to start saying, okay, consumer, if you want to go for a lab at a hospital, you're going to have to pay a deductible. If you want to go to a lab for a freestanding, it's going to be free of charge. So keep your eyes open for that. That's something that I know one of our competitors is doing within their plan designs, is really trying to engage the consumer in a new and different way. And that's shopping where you have a planned service. You can shop for those services. And then the other thing, and I think you probably already know this, but plan designs coupled with health reimbursement accounts and health savings accounts. So those are those tax-sheltered programs where you take a high deductible and you marry them with a bank account, if you will, that's tax-free, that you can then pay for your health care expenses out of that. So it's a softer cushion for people to transition from the copay world into the deductible world. Employers often put money into these accounts to soften the blow for the end user or the patient or member in this case. So what do we see? Saying all of that, we see that the average premium increase for 2010, unfortunately, is still 9 to 12%. So even with the buy down, we're seeing rate increases at that level. And I will say we happen to be one of the highest states in New England with these premium increases. Healthcare reform. So I think I got served up very nicely by talking about Martha Coakley. Well, I'll talk to you about Scott Brown. So I think many of you know that Scott Brown newly got elected in Massachusetts, which he's a Republican. And why that's important here in New Hampshire is because this federal health care reform, the whole dynamics change. Some people are suggesting that everything we've heard about on the news continuously is no longer going to come to be. We would argue at Harvard Pilgrim that we still think there's going to be health care reform, but we think it's going to be far more modest. Rather than sweeping changes that you see listed up on this slide, because this was created a couple of weeks ago, rather than these sweeping changes, we think that some more moderate or tempered changes will come to be. I will stream through these very quickly to try to give you a sense of what you can watch for and also try to entice you to get involved, because the employer voice is one of the voices that are not being heard. And your voice is the strongest voice because it does impact you. I know that healthcare costs are one of your largest line items on your employer bills. For that reason alone, you should stay involved. And there's some easy ways to get involved here in the state of New Hampshire. So near term, what do we worry about? Well, we hear constantly that there's no taxes, that these changes are not going to have a tax implication. Well, unfortunately, the health care reform that was being talked about had $6.7 billion in taxes annually that would have to be paid. How you can say that those taxes don't affect all of you is because they're borne by the insurance company. But Harvard Pilgrim is a not-for-profit insurance company, and I would contend our competitors that are for-profit and have stockholders to make happy, we can't absorb $6.7 billion. So it's going to be coming right back out to you in the way of premium. So it's a premium tax. There was a thing called a Cadillac tax for very rich benefit designs, pharmacy and device taxes. All of those taxes would just be embedded within your premium increase year over year. So just don't fool yourself to believe that there's no implication of this bill. There's large implications, and the employer voice needs to be there to help fight those. Benefit mandates, they were talking about covering people up through the age of 26 or through the age of 25, pardon me, and that would be for both fully and self-insured clients. Medicare cuts, so the more they cut reimbursement to the doctors, the more that gets shifted to the commercial sector and all of our premiums go up. Coverage expansions, talking about, there are people between Medicaid and the commercial sector that need insurance coverage. That's that corridor that the public option was trying to take care of. We truly believe that there should be universal access to health care. You won't find one health plan suggesting that this is not an important subject. It is a very important subject. How you get there is what's even more important. We have to make sure that we do it right. And so the Medicaid expansion would give people coverage. Individual and employer mandates, it would essentially mean, like in Massachusetts, if you did not have insurance as an individual or if you as an employer didn't offer insurance, there'd be a penalty to pay. Cadillac taxes for rich health plans, and there's just different tweaks within the law that you should really pay attention to and perhaps get involved. So what can employers do? Well, we would suggest that all of you can embrace the new wellness world and really do it. It doesn't need to cost a lot of money, and your health plan will work with you. But you could do things like walking clubs. I mean, I would say that the American Heart Association, as an example, has a free walking program that you could implement within your employer. So look for those easy solutions that you can embrace and offer to your employee base that don't cost you a lot of money. Healthy food choices. Look at your cafeteria. Look at your vending machines. Are you still offering candy bars rather than granola bars? Some of those smaller things. Weight loss competition, the biggest loser. A lot of employers are embracing that, saying, hey, let's have a competition. Competition is fun. Let's have rewards at the end. Offer on-site programs in partnership with your health plan. So do cholesterol checks, do blood pressure checks, and all of that your health plan can work with you on. And then consider options to improve the health of the community. So really think beyond your employer and think about how you embrace the larger community in this. And I'll just end, because I didn't do a good job starting my timer, so I have no idea where I am in time. But I will end by saying this. I really encourage you to get involved. The easy ways to get involved here in New Hampshire is if you do not have the resources to stay involved in the legislative activity, join your local chamber. join your local business and industry association. Those organizations have government affairs committees that will help you understand the legislative activity, both locally and federally, and give you a way to talk about that more broadly. Thank you.